Welcome to Radiologists, a podcast by University Medical Imaging Toronto, where we discuss the most interesting topics through the lens of Canada's largest medical imaging department. I'm your host, Satheesh Krishna, and today I'm joined in my studio by Xiaoyang Liu, who has recently joined the Joint Department of Medical Imaging as an abdominal radiologist, assistant professor, and clinician-investigator. And today, we're talking about navigating the challenges of early career in radiology, the tips, the role of mentorships, and how to balance work, life, family, and so much more. Xiaoyang has an incredible story for all of you. I'm really looking forward to a chat. Xiaoyang, it's great to have you in the studio.
Thank you very much, Satheesh. It's my honor to join you here today at the podcast. Looking forward to our discussion here.
All right, Xiaoyang. So what we are here to talk about is the story of the early career in radiology. But what is always funny to me is that in medicine, we are in our 30s and 40s, and then we finally say that, hey, we have made it to early career. It's like we've run all this way, but this is where the entire race starts. And this is the story we want to discuss with you. But what I'm more interested in is the story before the story. How did you reach at this point? What brought you here, and how did you end up in medicine?
That's a very funny point, Satheesh. Nowadays, as everybody can see, people in the medical career profession becomes, in terms of age, more and more mature when they started their early career. In particular, my experience is I completed the combined MD and PhD training, which is even extra 4 years more than the regular training. So I'm glad that all the training has been completed, and I'm now in the new step of getting into independent practice. It's indeed a very exciting start for me, very exciting stage of my career. And to answer your questions, how did I get interested in medicine and in radiology? It's a very long story. We'll just start with maybe, I've always been interested in cancer treatment and cancer care for the patient. That's why I did my PhD in cancer genomics and molecular pathology. After that, I went back to my med school to complete the rest of the 2 years and a half. That's when I started falling in love with radiology.
Wait. So you're telling me that you made life more difficult for yourself by doing a PhD in addition to your MD. So you are a doctor and a doctor. So it's Dr. Xiaoyang Liu. That's amazing. Satheesh, basically, to make it not sounding so intimidating, it's basically an opportunity for trainees to see both sides of medicine. We do 4 years of medicine, and then in between those 4 years, we have 4 years away to finish our research project on our PhD part. Oh, that's very interesting then. So does this program, is it different from the traditional MD programs? Because the way I see it, a regular MD program concentrates on individual patient care. But however, because you spend a lot of time on PhD, on research as well, now you look at medicine in a whole different way, in a whole different line of sight, because you're looking at it from the eye of a researcher. So it's much more systematic and how to push boundaries rather than individual patient care. Did that change the way you perceived medicine overall?
That's a great question, Satheesh. I would say definitely yes. These two are very different aspects of performing clinical care versus the scientific research behind it. Being able to integrating and get this combined training, I feel like whenever I encounter a question in clinic, I always think about what's the cause of it? What can we do to change it? And what's the behind the scene mechanism of this pathogenesis? For example, when we were doing, my PhD was based on cancer genomics and molecular biology, and we're focused on the pediatric brain tumor and young adult brain tumor. It's very different when you look at the data sheet, the table we have in research. They're basically numbers and, some categories. They're Excel sheets. You look at them, you try to find any trend, any association, any potential causes or predicting factors for patient outcome. But when you enter clinic, it's completely different. So we go into the ward. You see these young kids, 6 years old or even 2 or 3 years old with gigantic brain tumors. It's out of my word. I don't know how to describe that feeling. I saw them on the table. It's completely different when you see the patient. You see how much of an impact it makes, the disease itself, and how much you can make on the impact of patient's life by, performing research and also on clinical care. So both parts to me are an integral part of medicine, especially modern medicine. So I feel like I was very, lucky to be able to get exposure on both sides.
That's absolutely brilliant. And I think that it gives you an amazing balance in which you're seeing the data on a sheet. So you're armed with all data, which is all evidence-based and literature-based. But then you also have that individual patient to take care of the emotion and how to apply data to an individual patient. And I think that this is amazing. And I think that more people should opt for it, and maybe, more structured research should be part of medical curriculum itself. But the other part which I wanted to ask you is, now you've done your MD, you've done your PhD, so you're now a doctor. And after that, there's this famous line from the movie Casablanca, in which it says that of all the gin joints in all the world, she chose to walk into mine. Like, after that, you could have literally chosen any specialty. You could have gone into genetics, you could have gone into oncology, you could have literally done anything. Why radiology?
Another really good question. This is also a question that we encountered in our interview in residency. I always think of radiology as the brain in the hospital, meaning we really stands most of the time behind the scene, but we are at the cross-section of multiple disciplines. For example, we interact with internal medicine doctors, we interact with surgeons, pathologists. We host the tumor boards where we integrate a whole team of different expertise from different disciplines, and then we decide together on the patient care. At the same time, radiology also have the interventional component when we perform the biopsies, imaging-guided intervention. All of those require a lot of direct interact with patients as well. So really, we have a lot of different aspects in radiology. And then this kind of integrated pictures really intrigues me. In addition, a lot of research, cutting-edge research is happening in radiology. We're integrating machine learning. We're very image-based and technology-based specialty. So, for example, we always have new imaging techniques coming in. Nowadays, we're into AI. So there's a lot of exciting research happening at the same time, in addition to the, being the brain of the hospital. So I think I'm making an ideal selection for my choice here.
That's just really fascinating that you were able to assess the situation, know where you could cause the most impact, because that's at the intersection of clinical care and research, as you rightly put it, and shows something which is perfect for you. However, I've asked this question to a lot of people as how they chose radiology, and every person's answer has been very different. And I think that till date, yours takes the cake. In my career, I chose radiology just by blind dumb luck. And I think that that's the best thing that ever happened to me. But that's the story for another day. But after choosing radiology, where did you do radiology and how did you go through radiology training?
So we have 5 years of radiology training. Usually, that's our residency program that happens after medical school. For me, I did my radiology residency at University of Toronto here, where I continued as a staff. In between my residency and at the start of my independent practice, I went to Boston Brigham and Women's Hospital at Harvard. The program is called Abdominal Radiology and Intervention for 1-year training. Nowadays, a lot of radiologists actually have extra training outside after their residency, being fellowship, where they get more subspecialized in a particular area in radiology. In my case, it's the abdomen part, and we also receive a little bit of interventional component as well.
Wow, so you did your MD, PhD, and then University of Toronto, Harvard. So you have like a long lineage. So after fellowship, you came here and you started back in your alma mater as a staff. What was the transition like? Because in my mind, that's one of the most difficult transitions, right? Because all through your childhood, through your career, till that point, as a medical student, as a resident, as a fellow, you always had some kind of supervision. But so till June 30th of the year, you have supervision, and all of a sudden, July 1, you're the staff. You have residents and fellows to supervise. In a matter of a few minutes, you just become from a trainee to a staff. It's almost like tightrope walking. You were walking the tightrope all along, but you knew that you had that safety net below. And then suddenly, July 1, they just take off the net, and now you have to navigate the same thing. You've done that a million times before, but how did that feel like for you, that change?
Definitely a lot more careful when the safe net is not there anymore. It's very different. You're right. When we first started independent practice, because the main thing is the mentality changed. As you mentioned previously, there's always going to be a second eye looking at your report, anything that you potentially missed or any additional things that's added in the report. But the day that we become independent, we're all on our own in a way, being independent. The report is final. It goes to the patient directly. It goes to the referring clinician directly. So that's a lot of responsibilities. In my case, what I really appreciated when I started was this. We have a program at GDMI UMIT, being the first month when I arrived. We get paired with a more senior staff who had more experience in each rotation. For example, Satheesh probably remember when we were doing the biopsy together. That was my first day in the biopsy center. And he has to introduce me to the nurses, to the technologists, ultrasound sonographers, and the rooms. And the procedures, we've done them many, many times before, but the system is still, even though I was trained here, there's still a lot of new things, how to navigate those. I find it extremely helpful to have someone more senior to help with the transition, which I appreciate a lot.
That's a great idea, to pair the new staff with people who have been here so that they can get used to the system quicker and get integrated faster. But other than that, after the 1 month, you were kind of by yourself, right? Still, this is a big place in which we have different people with different skill sets of different points in their career. And how did they help you, or how did they mold you, or did you have good mentors here or even earlier? And what is the role of mentors in shaping your career specifically?
Yeah, I would definitely say mentors are one of the most important factors along the medical career, starting from
when I was a medical student or PhD student, going into residency, and now even as an independent staff, there are multiple mentors who have been extremely helpful for me. You mentioned that we have a lot of different expertise and people in our department, which I see it actually as a bonus for our practice. For example, when I first got here, you probably remember, no matter how good we are, how much training we got, there's always going to be rare cases that we've never seen. And I just feel so comfortable, when I first started my career, just pick up the phone, and then call someone, in our department, in our division. A good thing is in our division, there is a world-renowned expert in almost every single small organ, in particular in our case in the belly. You can always find someone who's so good, who's so well experienced, and then give you a second opinion on, which I feel was extremely, extremely important for early on career. That helps us to develop confidence, helps us to navigate the difficult cases, and help us better interact with the clinicians.
Yeah, that's incredible that you mentioned that, because that was one of the first things which I thought when I moved here as well. This place is packed with super people or superheroes. This is kind of like the cast of Avengers, one of the best teams assembled ever. But now you are coming in as a newbie into this team. And what it is, how does it feel to be a part of the team? Because you have such excellent accolades, and despite you being amazing, ultimately this place requires a well-oiled team to run in. And did you have any difficulty fitting in the team, or how does it feel to be a part of this team here?
I would echo of what you just said. It's an incredible team. I have to say, the minute that I decided on this position is because I've worked here as a resident. I've seen the people in this group. I know what kind of environment I'm getting into, and I'm feeling very comfortable, very happy for my choice of staying in this institution, in our group. There's a lot of help in addition to what I've mentioned on academic. There's also a lot of help on the collegial way. For example, radiologists work in a group. We cover a different time point, different call shifts. We have people at different sort of life stage in their career and in their personal life. As a young mother, there's always time when, your baby got sick, you got phone call from your daycare. I can always find someone very reliably to help me changing shift or like covering each other. I always feel very supported by my group of people here, which I find is extremely important aspect in this group.
I'm very happy that you feel right at home within JDMI. But speaking about home, you just said you had a baby. Congrats. It's just amazing to see someone so successful and then managing to balance everything as well. But how do you do it? Like, how do you balance work, your personal life, social life, as well as your academic life? How does the balance work? How did you have any difficulties in balancing it, especially in the early career when there is a huge transition involved?
It's definitely a biggest challenge, balancing family, especially early on when the kids are small, family are just starting, to balance career versus family life. I have to say, as a mom, I always have this guilt. I probably didn't or haven't spent enough time for my daughter. When I was in training for fellowship, I was away from my family and my daughter for the whole year. And even when I came back, as starting staff, there's always something you need to catch up, you need to learn. I just don't spend enough time. We call it a balance between family and career, but I feel, there is a certain sacrifice we have to do, especially as a female physician, a female radiologist. We try as much, for me, I try as much as I can whenever I'm not reading a scan or when I'm not working. I spend every single second with my daughter. And I take her to sleep or playing with her, chatting with her, although she's only speaking some preliminary languages so far. But, that's as much as we can do. It's just a matter of right now, I think Korea is taking more of a priority. So I'm always in guilt for my family.
That's always a tough line to walk, trying to keep everything in balance. But with COVID and introduction of work from home, and I think especially as radiologists, we do have a bit of flexibility. Although not as much as people think, we do have the bit of flexibility in our specialty itself, as well as in our group, because our group is big enough that if you do have emergencies, we're able to kind of cover you and help you with that. So how did that kind of factor in or help you with the transition?
Yeah, that's a very good point. I think being a radiologist and being able sometimes to report at home is definitely a very precious gift for me, or I guess any early career radiologist. Number one being, you have the flexibility. For example, when you're reporting at home, you can send your kids to school early morning and then continue working. In my case, sometimes we host multidisciplinary tumor boards, and sometimes the kid has to be at home. I think the whole field of medical career, everybody now moved to the point that they understand sometimes, family cannot be separated, especially when you're working from home. With COVID, people are more and more used to this kind of scenario. And that I've seen actually people's kids coming into the room in the middle of the meeting and then leave, as long as it doesn't interfere with care, with patient care, with our work. I think this is a bonus for us.
Yeah, this ability to work from home is one of the positive things that came out of COVID. Like, of all the chaos out of it, this was like one good thing, like Pandora's box, like one good thing which came out of the entire COVID scenario. But I think that more and more people are talking about work-life integration as opposed to traditional work-life balance. Earlier, it used to be that you had to balance work and life, which meant that you kind of had to take something from one side and put it on the other side. But now, there is, with work from home and other things like this, there is a possibility of work-life integration so that it seems more seamless. So what is your recipe for wellness? How do you keep yourself sane and all the chaos going around you?
I mean, I definitely feel very recharged when I spend time with my daughter. I think being together with family, like you said, integration between family life is an important aspect for keeping sane, if that's a word people are using now. Nowadays, I have less social time per se with friends, but we still try to get together a lot of the time. I love cooking, making, although I don't do it that often anymore since the practice started. But once in a while, cooking for family is very enjoyable. I also find it very relaxing. I play the piano sometimes for charity events. So I find that's also just deviate my brain away from radiology and from work.
To everyone who's listening, I'd like to point out that this is how life is in one of the top centers, in the high bar we set for ourselves. You have heard that somebody who has done MD, PhD, taking care of a kid with a career transition in Toronto, Harvard, then plays the piano, cooks, and does everything possible, and still feels a little bit of guilt for not having done something better. That's the standard that we hold ourselves to. But talking about like your academic pursuit of yours, like your title says, abdominal radiologist, assistant professor, clinician-investigator. It's almost like the Khaleesi of the Great Sea, protector of realms, breaker of chains, mother of dragons. What does that mean in academia, and what are you in academia?
I think in one word, basically a
a clinician scientist. That's the ultimate goal that I want to become, meaning being able to care for the patient, move forward our field in both clinical care and the research side is the ultimate goal. And that's no matter how long, they're all letters behind your name, but that's the final meaning of it is what we do after all these training.
So that sounds perfect for you because it seems like you love working in teams and you're at the intersection exactly where you wanted to be all along. But working in teams, there is always a lot of interaction and communication, and I understand that's something which you love. But quite often, you have to give feedback to others. And in your early career, you receive feedback. And it's an interesting place to be in because on one hand, you're providing feedback to everybody who's listening to you, but then you get feedback as to how to improve yourselves. And it can be conflicting a little bit. And how do you take that and how do you handle that?
Yeah, it's definitely a two-way communication in this aspect. I think no matter what stage you are in medicine, being a trainee, early career, or even when we are more advanced in our career later on, I think this two-way feedback is always going to be happening. For example, I always feel very lucky to have people who are telling me to be able to discuss things and how to improve. And I also feel every time I work with a trainee, my standards is usually I talk to them right after every training session. For example, at the end of the day, we'll be talking about things that I think can be improved or things can be worked on. I feel prompt feedback is the very important aspect for us to improve our practice. No matter how much we strive for perfection, we're never going to be perfect. I think it's a nice window to have this feedback, to have this atmosphere where people feel very comfortable of giving feedback and receiving feedback, to have a very safety kind of network for patient care.
So what you're saying is that it is all in perspective because some people are so worried when they get feedback because they feel that they're letting themselves down. But you're absolutely right. I think any feedback is for constructive purposes because you want to make yourself better. You want to make everyone around you better so that the team can function much in a much better fashion. So Xiaoyang, now that you're here and you're in the process of navigating your early career challenges and you're coming out with flying colors all over the place, what advice would you give to those considering radiology as a specialty and especially those who are at the early stages of their career?
I think I would say definitely a great choice so far. I mean, there will be difficulties, no matter what kind of practice you choose, in terms of clinical practice, but there's no difficulties that cannot be overcome. I'm very lucky to have chosen a very supportive group, which made this transition very smooth for me. But, in any situations, just don't always be confident, always, be confident that you will be able to overcome any difficulty facing ahead. So I just want to wish everyone, fly high and fly safe.
Ladies and gentlemen, that was Xiaoyang Liu, abdominal radiologist, assistant professor, clinician-investigator at JDMI, the Joint Department of Medical Imaging, Canada's largest medical imaging department. This is your host, Satheesh Krishna, and see you in the next one. You were listening to Radiologists, a podcast by University Medical Imaging Toronto, the largest medical imaging group in Canada. Produced by Ina Levchuk. Learn more about us at universitymedicalimagingtoronto.ca and follow us on social media at Imaging Toronto. Thank you, everybody. See you on the next one.